Hello YouTubers, it's me, Katie again. I haven't made a video in a while, so I thought that I would update and let you guys know that yes, I am still alive, and two, I am still sober. On the darker side, I'm still having chest problems, heart problems. As you have seen in my other videos on the Holter monitor, that test came back with no results, so on the 6th of December, I'm going to get an event monitor, and I will probably wear that for about 2 weeks to a month. I'm still having arrhythmia, which is pretty fast heartbeat. It's actually slowed down a lot compared to what it used to be, so that's always good. Other than that, I've been pretty stable mentally. I have gone to my therapist twice last month, and she thought that EMDR therapy could be very helpful in my situation. Due to the trauma that I have been through that I have a hard time of letting go of, I have been doing overall much better. It's a lot easier now being sober, but it is still hard with the challenges of wanting to smoke. But I have the willpower to say no, and that makes me feel good about myself. So therapy-wise, the last time that I went in, my mom went with me, and we discussed a possible dissociative disorder, which is known as dissociative disorder not otherwise specified. In my specific case, I have sometimes feelings of disassociating and blacking out, and I feel like I'm another person, which can be very frightening at times. Other times it doesn't really bother me because I'm not really too sure what's going on. I'm not really all there at that time. So it's been kind of frustrating, especially trying to get support from my family, who doesn't really understand the term dissociative disorder, NOS. It basically is kind of like dissociative identity disorder, but the not otherwise specified means that I don't fall into the category for dissociative identity disorder. Meaning a lot of people with dissociative identity disorder have time loss, which I don't suffer from, and their personalities have their own like looks, likes, and memories, and like a certain way of talking, whereas mine don't. They look like me at various stages in my life. The only one that has a name is Riley, and she's 4 years old. She enjoys doing what any 4-year-old child would enjoy, playing with dolls, Play-Doh, going to the park and playing on the playground, which is socially awkward because I am going to be 21 in 18 days, and it does make it a little more difficult to feel comfortable with letting her do that. The other three, Scared is 12. Scared developed after the abuse with my father. 13 is sad because she's kind of going through what I went through at 13, which is the hallucinations, anxiety, panic attacks, blah, 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 all that crap. Forgot I had a cigarette lit. And 14 is angry. 14, angry is 14, duh. Angry developed when I was 14 and was on medication Prozac. I stopped taking the medication and it caused severe anxiety, but also severe aggression towards other people and towards myself, which I'm starting to believe that maybe angry came out at that time and took over for me, because I look back in like my school papers and remember like getting these reports saying that I did things that I don't remember doing, but that I can sort of remember, because part of my dissociative disorder is to kind of lose a little bit of memory on what I did after it happens. but then after a while it will come back really slowly. So yeah, those are the different parts, and we are going to work in therapy, me, my mom, and my therapist, on integrating my so-called personalities. I don't really like to call them that. I'd prefer to call them alters. But integration is a process where you integrate the separate personalities into one being, me, of course. So yeah, I have a lot of EMDR to catch up on, which EMDR is called eye movement, something, I don't know, honestly, I don't know the whole friggin' synonym, I can't even talk right now, the acronym or whatever for it, but it is very helpful therapy if you have ever gone through severe trauma, such as I have, and the only reason that I haven't been able to do EMDR for so long is due to my dissociative state when it happens, or when I have a flashback, I often disassociate to survive the pain. So that's been kind of hard. But with my mom's support, we are going to go in there and try and get this taken care of. A lot of problems from EMDR in the past, of course, would be dissociation, but also extreme bouts of self-injury that I do not have control over. There are scars on my body, like right here, if you can see. During an EMDR session, I had a very bad flashback and started digging my nails into my skin. My therapist tried to stop me, but I'm very headstrong when I'm going through a flashback and I'm not completely aware that I'm scratching myself. So we've decided that for this upcoming EMDR session that I am to bring a pair of gloves with me, so that way it makes it a little bit easier for them to stop me if I do go through that self-injurious behavior. There are other times when I would sometimes smack my leg, like just because I was upset, and my therapist would be holding onto my hand and I couldn't scratch, but I would pull away from her and start punching myself in the leg. So yeah, we're coming to terms with that the risks, or the benefits outweigh the risks, that with my mom there, I should hopefully feel more supported. So that will help out a lot. So in the next few months, I'm going to work a lot on EMDR and try to do what I can to get better. I'm also still taking all of my medication, and I'm still sober. I'll tell you guys a little bit about that. Thursday we'll make a month and a half sober off of marijuana and K2 spice. So that's a very good thing because my health was very quickly deteriorating because of my drug use. I had pretty severe bronchitis and was not able to breathe very well. I had to use an inhaler 6-7 times a day just to be able to open my lungs up and breathe. Since I've quit smoking pot, I haven't really had as bad a case as bronchitis. I still smoke cigarettes, and that still can sometimes cause the wheezing. So yeah, mostly everything is going good right now. Still having some pretty bad problems with my dad with the emotional abuse. Him just saying really mean things that bring me down. And I'm learning now how to cope with it, such as walking away, taking the dog for a walk, turning my iPod on and just letting the music, drown out my anger. So yeah, I just thought that I would make another video because I haven't made one in quite a while. So I just thought that I'd let you guys know, yes, I am okay, and that I'm doing much better besides all the heart problems. And I will probably update another video once I get my event monitor to show you guys how it works. So if you could subscribe, I will also subscribe to your channel. Don't leave rude comments because your comments will be deleted and I will block you. So it was nice seeing you guys again. See you later.